Today we are going to discuss one of the most important diagnoses in traditional Chinese medicine, pulse diagnosis. Firstly, I'm going to introduce the location of pulse taking. The location is about the wrist where is the radial artery flows. In other words, it should be located on the thumb sides. It is divided into three regions, 寸, 关, 尺. The region opposed to the stereo process of the radius is known as guan. Just slightly put your middle finger on the region and press it till you can feel the pulse. Then place your index finger and ring finger on both sides of your middle finger, which are next to each other. Index finger regions distal to guan is 寸, while the ring finger region proximal to guan is 尺. And the location of these three regions is the same on both hands. The three regions of 寸, 关, 尺 of left side reflect the conditions of heart, liver, and kidney yin. And those of the right hand reflect conditions of lung, spleen, and kidney yang. 寸, 关, 尺 are the three important regions that help you feel the pulse in pulse taking. In taking the pulse, let the patient place his or her hands on the desk and the palms up and relaxed. First, locate the guan region with the middle finger, and then put the index finger and ring fingers naturally on 寸 and 尺 regions. A normal pulse is of medium frequency, 4 to 5 beats per breath, and regular rhythm. It is even and forceful.
We are going to introduce abnormal pulse, floating pulse.
Floating pulse, the pulse responds to the finger when pressed lightly and becomes weak on heavy pressure. This often occurs in the earlier stage of an exogenous disease, an exterior syndrome. It may also occur in patients suffering from prolonged illness and who are in a stage of general weakness. In this situation, however, it is more often superficial and forceless.
Deep pulse. Superficial palpation reveals no clear pulse, which is felt only upon heavy pressure. This often occurs in interior syndromes.
Slippery pulse. The pulse feels smooth, flowing, and fitful, and often occurs when there is excessive feeling of retention of food. Slippery pulse may be observed in healthy people with animal qi and blood, and during pregnancy in women.
Wiry pulse. The pulse feels taut and flexible as though pressing on the string of a drum bow. It often occurs when there is insufficiency of the yin and hyperactivity of the yang of the liver.
Slow pulse is one of the pulse. The slow pulse is the opposite of the rapid pulse. The rate is slow with less than 4 beats per breath. This often occurs in cold syndromes.